All right, good morning everybody. My name is Enrico and I'm going to speak to you about assessment in the space of simulation, and in my speciality that is in paramedic sciences. And how does simulation assessment really relate to actual clinical practice? Now, most of you in the medical space will be familiar with simulation. We put a mannequin on the ground, we need to do CPR, we need to do a couple of things. It's a pretend. We are pretending a scenario, we are doing something, and we are practicing some skills, some thinking processes, etc. Now this has come from the military that's been using simulation for many, many years to try and refine and perfect military strategy, and that has been adopted in the medical sphere because we can't always do certain procedures or have students do certain procedures on patients without actually being able to do the skill practically. Now there's a big change in the way people are thinking about fidelity, and fidelity is about how real are we making things. At the time when I submitted this abstract, we just completed a review specifically looking at all the simulation research that's been done in paramedic science. And on the one hand, we have people that's creating mannequins that's almost lifelike. And then you face something called the uncanny valley, where the student looks at this mannequin, it looks almost real, but it's not quite, so it's eerie, so it throws them off completely. So in my experience, it's about the time component. If we have a time stressor in our simulation, it really creates that environment of reality. You can have pictures against the wall, live ambulances, it's still not the real thing. And what we have found is students will tell us, it's not the real thing. It doesn't feel the same. So it's almost like we are gamifying what we are doing in simulation. It's becoming a game. There's a tick box. We need to do A, B, and C, and then I will pass. But what we have found through communications with our students and actually going on the road with our students and seeing what they're doing in clinical practice is that they can't always translate what they've done in a simulation to an actual patient. People are different to plastic mannequins or boxes or arms and things like that. It's no longer a game. And in my experience, it's about the application of consequence. If I'm going to do an act, there's going to be a consequence to that act. And I think that is very much lacking in when we're assessing using simulation, because simulation is an excellent practice tool. We can practice as much as we want, but until we have actual consequence, do we actually have competence? So the question could be, any medical practitioner, are they really competent when they're finishing their qualifications? Now it's about doing skills, and skills is normal psychomotor skills. I can, do things with my hands, open up suture, do such things, which I can learn, we've sent the monkey to the moon and they're able to operate. So it's very easy things to learn. And then we've got competency. Now, don't confuse this with, there's competencies and there's competence. Competencies is about decision-making, applying your knowledge, taking everything you've learned and putting that into clinical practice, maybe a treatment strategy for your patient. However, there's different levels of proficiency in that. I can be a very basic practitioner with limited knowledge and be at the bottom range of the proficiency ladder according to the National Institute of Health. Or I can be at band 5, where I'm really good at doing what I'm doing. I'm really good at applying what I've learned and able to do my skills. Now, this is just an example of putting an IV cannula in an arm. There's quite a difference between putting a needle in a plastic arm and putting a needle in an actual patient that's going to have fears. The patient's going to have pain. There's going to be blood probably pooling all over the place. So the question is this the best place to actually determine whether our students are competent? Now, I believe that this is a great place to practice to get baseline proficiency. But actual competency testing of these types of skills in the medical sphere, in my personal opinion, needs to be done in clinical practice with the real patients. So when it comes to assessment, how are we using simulation, especially now after the COVID process? Nursing has gone very much into simulation because there's a restrictive amount of placements in NHS trusts. But I think it is better to go with the medical model, especially for our allied health, our allied health professions, to have the practice in the universities, in the training centers, to actually be proficient at doing things at a basic level, but to actually attain competency and be assessed on that competency in practice.